Well, Clay opened it up by saying he'd seen me in counseling. Do you think it did any good? Did something at Woodmont in the spring, and when you get invited back, you're never quite sure whether you did an okay job or they're just going to give you another shot. But whoever has been in charge of promoting this thing, it's really gotten embarrassing. I'm kind of anxious for the series to be over so I don't have to keep seeing my name all the time. I'm really pushing it good. And my kids are giving me a really hard time about this wildly popular line. So anyway, my wife Olivia, and we've been visiting Woodmont for the last several months, and we've very much enjoyed the friendliness and the message of this church and this congregation. Livy's also a therapist. She couldn't be here tonight because she is picking up our daughter who is in a school for special needs adults in Mississippi. So Livy and I have been married, second marriage for both of us. We've been married almost 17 years. We each brought 3 kids with us to the marriage, and then 5 of those 6 kids got married, and now we got 12 grandkids. And so when you put our kids and their spouses and grandkids together, now 25 of us fitting in our condo. So it gets to be quite the crowd. When Clay approached me and said, would you do something on marriage and family issues, that kind of stuff, the first thing that popped into my mind and popped in loudly and quickly was anxiety. Anxiety is the biggie in our culture right now. If for the last 10 to 15 years, anxiety has been the #1 diagnosis for kids and adolescents. And what I am reading now is by 2020, if you take all the diagnoses we have for cancer, cardiac, diabetes, et cetera, that anxiety will be the #1 diagnosis in our country. So 2020 is just barely around the corner. 1 in 7 kids probably would qualify for the diagnosis, and I want to come back to why that's important. Nationally, they're saying 5 to 8% of kids miss school each school day due to anxiety issues. If you add ADHD to anxiety in terms of a kid diagnosis, we, for years and years in Tennessee, were #1 per capita prescribing meds for kids. And last year we got beat out by Kentucky, which is not particularly a meritorious thing. We've seen a 50% in the last 8 years. We've seen a 50% increase in adolescent hospitalizations, and we've seen a 70% increase in referrals to mental health centers on college campuses. So it just keeps getting bigger and bigger. If you look in the DSM, which is the manual for providers that we use to diagnose, there are 11 different kinds of anxiety. And I'll just mention a couple that you're probably most familiar with. First would be OCD. That has to do with the obsessive thinking and then the compulsive behaviors. If you saw the movie As Good as It Gets with Jack Nicholson, which is kind of an old movie now, probably a really good characterization of what OCD is like. Folks who have OCD, really they suffer a lot more than you might think. Just the perseverating, the obsessive thoughts cannot get out of their heads. And then the rituals that go along with the compulsions that feel like such a must and are completely lost without it. And then there are panic attacks. I'm typically not an overly anxious person unless I'm standing in front of a crowd of this size. But panic attacks where you got the severe physical symptoms, you got dizziness, you got shortness of breath. People experiencing a panic attack literally feel like they're dying. 24% of folks that go to an ER complaining of what they think might be a heart attack are suffering from a panic attack. And then there's PTSD, post-traumatic stress disorder. We tend to equate that with veterans, but following any kind of trauma. What is showing up in the literature more and more is PTSD that shows up in families. What I am seeing sort of anecdotally in my practice is PTSD symptoms of bullying type behavior, it's an overused word, that are happening among siblings, where siblings are picking on each other excessively, even hitting each other. In another context, I would talk a lot, I got zero tolerance for sibling rivalry. It's a name we've kind of created to sort of make it okay for kids to be that way with each other, and it's not. The most common sort of anxiety in the DSM is called GAD, Generalized Anxiety Disorder. Women are twice as likely to experience this as men. It is by far the most common. To qualify clinically for the diagnosis, it must persist for 6 months. And then the last one I would mention are the phobias. I can't tell, I was trying to figure out this afternoon exactly how many phobias made it to the list in the diagnostic manual, but I'm guessing somewhere around 24. Okay. Clay, several months ago in a sermon, he differentiated fear from anxiety, and I think he accurately said, with fear, you can name the thing you're afraid of. With anxiety, you can't name the demon. You can't really specify what it is that's bothering you. And then we define worry as the combination of fear and anxiety. And the symptoms that go with that are a vague sense of tension. You're not quite sure what it is you're experiencing. You're just uncomfortable. It is particularly difficult when that vague sense of tension doesn't seem to fit very well with your life. It's particularly difficult when your life seems like, gee, I'm in a pretty good place. Why is it I'm having a hard time just settling down and being able to experience it? It is by far and away our most physiologic emotion. I'll come back to that. For kids, and this seems a little bit surprising, but oftentimes with kids you get postnasal drip, you get a raspy voice or stuttering, acid reflux, they got a stomach ache a lot, and there's no real fever, you're trying to figure out, are they just trying to get out of going to school? And sometimes they are. Particularly with adolescents, they will talk about something is missing. Something is just not right. And adolescents particularly will talk a lot about, I can't figure out what it is. Everybody else seems to be getting it. I don't. Everybody else seems to know something. I don't know. The FOMO, fear of missing out kind of stuff that goes, particularly with the social media stuff. And there's this sort of underlying, what are others getting that I am not? And a very much an out-of-control feeling is I feel like I've lost control of me, and I'm not quite sure what that's about. With kids, and this may sound a little corny because it is you can almost hear it. When you're around a really anxious child, there's almost a buzzing that goes on. They are so wound up, they are so tight, that it is so problematic they can't just relax and be anything. With both kids and adults, and particularly for adults, one of the ways you can spot anxiety is they seem constantly irritable. And that's a major symptom that goes in the adult population. The clinical definition of anxiety is subjective apprehension. You put all these things together, and that's the label that goes with it, subjective apprehension. You can't figure out what it is you're apprehensive about, you just know it's there. The sources, there's no one source. The media is certainly one. I found myself this Sunday watching some documentary on 9/11 and found myself reliving the anxiety of that day. Okay, one tower, second tower, Pentagon, plane, what's next? And even though I know the rest of the story, is just reliving that day of 9/11 can re-experience the anxiety that went along with that. For kids, overwhelming homework shows up a lot. You get the sense with anxious kids, and I'm going to come back to why this is, you get the sense if you would just settle down and do your homework, it would take you about 20 minutes. And you seem to be so sort of either procrastinating or wound up, it's taking you way too long. Just get settled down and get it done. Just do it. One of the things we're seeing in Nashville since the flood of 2010 is weather-related anxiety. Somebody who was deeply affected by that flood, they hear flash flood warning, and their anxiety gets rekindled and elevated almost immediately. Parental tension. This is a huge one in family work. Is kids, if there is a tension between the parents, or there's too much tension in either parent, but particularly if there's marital tension, the kids will get anxious. If there is tension in the parent connection, and if the parents are anxious, and by the way, I seldom, if ever, see an anxious child. It's almost always an anxious family. But if there is tension between the parents, there is 7 times more the likelihood that the kid is going to develop an anxiety disorder. Social media is big. There's an interesting study came out of Britain a few months ago where it said 6 out of 10 parents are worrying about their kids' use of screen time. In the very same study, 7 out of 10 kids are worried about their parents' use of screen time. So there's a whole notion, just to give you, maybe it's a bit tangential, it's sort of the rule of thumb for lower school kids is we think in terms of 7 hours of screen time a week. With middle school kids, we think in terms of maybe 10 hours a week. And we're really starting to push hard. No cell phones before the 6th grade, maybe the 7th grade. I would like to say 7th grade. I can't get away with it. But anyway, that's the source of anxiety that goes with that. There is no, to date, clear genetic marker for anxiety. So the nature and nurture thing, it may be in there someplace because there seems to be parts of the brain in anxious people that's highly active and overactive. But we're not seeing that, at least yet, where they're discovering a clear genetic component to it. Personality factors. The big one is perfectionism. That's probably the number one characteristic of anxious people is perfectionism. When I was growing up, my parents just kind of hoped I'd be good at one thing. My dad, almost to the day he died, still hoped I'd get a real job. But you can see it, the perfectionism setting up in families. You got a kid, and because we want early intervention, the kid's having trouble in this subject, so we get a tutor for this. And the kid's having trouble in this subject, so we get a tutor for that. And we set up this expectation that we got to be good at everything. And it sets up pretty early in developmental stuff that makes some sense at one level. But as a bunch of Christians, we ought to get it. We're just a bunch of screwed up sinners in need of redemption. We're never going to get there. Give it up. But the need for perfectionism is a profound dynamic. The second is an excessive need for approval. If you're talking to a highly anxious person and you give them 100 compliments, and then you give them one thing that you would like them to work on, they will spend the rest of the day focused on that one thing. Is the excessive need for approval and a high sensitivity for letting them say, be there, okay, telling them they're okay. Excessive need for control. Anxious people oftentimes look like control freaks. I want to argue this one. I don't think, my experience with people who are anxious, they're not that controlling. They just have such a low tolerance for being out of control. Is not being in control is what really sets them up. Excessive response to rejection. We're seeing this so much in adolescence, where a girl breaks up with a guy, and you want to go, that really is upsetting, but really? And the capacity to get up, dust yourself off, get back in the fray. It seems like it's not there. In another kind of context, I do worry, I think we're raising a bunch of wusses, in the sense of kids unable to take the tough stuff. I think one of our most important tasks as parents is teaching our kids how to be miserable successfully. It's just a life skill we got to make sure they get. Excessive caregiving. People who are caretakers on the excessive side, they're really, really good at taking care of relationships. They're really, really bad at taking care of themselves in relationships. And that sets up a lot of potential anxiety. Unrealistic expectations. I'm going to talk about this a little bit in the marital context next week. The research on marriage is that about 70% of marital issues don't resolve. We have to learn to manage them as dilemmas, and I want to talk about that a lot next time. But we have expectations for people, we have expectations for relationships that just aren't going to work. And then the final is unrealistic thoughts. See it in my marital work a lot with agreeing on a budget. And one of the spouses goes out and spends money that was outside and exceeds the budget. And the first one will say, we agreed on this amount, and you spent X amount. And then the second person says, yeah, but I saved 70%. Pretty illogical kind of way of going about it, but that's the kind of stuff that sets it up. In anxious people, we talk about the 4 Ds. The first is disproportion, way too much response to something. It's sort of like the rejection of somebody breaking up. Yes, what has happened is upsetting, but really, that much? It's a disproportionate response to what has happened. The second D is distress, way too much internal anguish. can't sleep, can't seem to let it go, can't seem to focus on anything else. Just seems to get so obsessed about what that goes on that internally there's almost this paralytic effect that takes place. The third is duration. It goes on way too long. That happened back there, and you're still obsessing about this right now. It's way too much. And then the final is disruption of life. Can't get back in the game. Never quite recover. Never ever going to play soccer again. Never ever going to take another math class again. That the disruption to life seems excessive to what just happened. In parenting styles, anxious parents also seem irritable, and they're hard to be around for their kids. But in parenting styles for anxious families, it tends to be parenting on the extremes. There's not a balance in kind of the parenting style. The kid does everything right. Mother of a preschooler a few weeks back said to me, "Yeah, I know she bit that kid, but it was so cute." What? Okay. Kid does everything wrong. Dads are bad about this with athletics. It's always interesting to go to my grandparents' soccer games or athletic events. There's one coach on one side of the field, and there's 25 parent coaches on the other side of the field telling their kids where to go. I mean, it's kind of like, you've got to be confusing to all those kids out there. Parents who make all the decisions. My favorite story about parents needing to make all the decisions is I worked with a high school senior a few years back, and the parents insisted that he apply to Vanderbilt. And he desperately did not want to go to Vanderbilt. He desperately wanted to get out of town. And they said, "No, you have to apply to Vanderbilt." So he did his entire Vanderbilt application with crayon. And then parents who make none of the decisions. You can drink at our house. All you got to do, in fact, you can all drink at our house, just got to leave the keys when you come in. And not paying any attention, that's illegal. What are you doing? And then the next one will be parents who are always clearing the way. You remember about 10, 15 years ago, we talked about helicopter parents? And then about 10 years ago, we changed it to Velcro parents. Parents are all over everything. And now, the last 5 years, we've changed it to snowplow parents. Parents that are just clearing the way, that are denying kids. In another context, I talk a lot about the two skills that I want kids to have to launch are empathy and resilience. And parents that seem to do everything that denies kids a chance to develop the resilience that they need to have. Okay. And then parents, no matter what the kid, it goes unnoticed. Parent who says, "It's no big deal that I miss parents' night." Well, it is. Anxiety. Here's where it gets a little complicated. Number one, it's the most physiologic emotion we experience. It constricts blood flow in the veins, and it limits oxygen to the brain, which inhibits concentration, creativity, and memory. Now, what is it that kids need to learn? Concentration, creativity, and memory. But it is so physiologic that if you are an adult and you are chronically anxious, you are going to get sick. It has that profound effect on the body. It's just going to go to wherever your genetic weak links happen to be. Secondly, it's the most contagious. You can't be around an anxious person without catching it. If I am doing marriage counseling with a highly anxious couple sitting across from me, they walk out of my office, I am wired. And I've learned how to use that diagnostically, but you can't be around an anxious person without catching it. That's why I say I seldom see an anxious kid. It almost always is going to be an anxious family. It really also leads immediately to catastrophic thinking. The kids in the 3rd grade, the teacher sends home an alert or a parent conference that says, "Here's one area that I think your kid needs to work on." If you got an anxious person, they got that kid in juvie, on drugs, promiscuous behavior. They'll go to the worst case scenario because just one thing got mentioned that this kid needs to work on. When we get highly anxious, it's not like we just move down the continuum on our level of concern. When we get anxious, depending on what our level of anxiety might be, we go to the worst case scenario, and that's where we live. The couple has a fight. They're going to get a divorce. She's going to leave me. He's going to leave me. Okay? It hijacks everything else. Anxious people look like they don't have much empathy. No, that's not at all. They're just trying to stay afloat. Okay? And here's the meanness of it. The anticipation of it creates it. If you think you're going to be anxious next Thursday, it might as well be next Thursday. That if you think there's an anxiety-producing situation down the road, you might as well be there. Now, on the positive side, highly anxious people get mugged and robbed a lot less. They do a much better job scanning everything. They're on this high alert all the time. And so the incidence of muggings and robberies among anxious people is a good bit lower than the general population. So where do we go with it? What do we do? Here's the rule of thumb, is you do not avoid it. The cliche is face it, embrace it, erase it. You look it straight in the eye, you go after it, you go in it, and eventually it becomes erased. That's true unless your phobia happens to be sharks. You don't face that, erase that. So interventions. Talking about anxiety actually tends to increase it. If you got an anxious person and you give them a lot of audience to the anxiety issue, it's like a form of self-stimulation. We think we're giving them a chance to vent and purge, to let go of something. It doesn't work that way. It goes the opposite direction. The more you talk about it, the more it escalates. So the rule of thumb in this day and time is you teach skills. But the interventions for anxiety issues are highly didactic. So I'm going to tell you some of the stuff we pay attention to. And then I'm going to give you some sort of down-home things that you're going to think, this guy's lost it, but I'll tell you this stuff works. And a lot of these interventions for anxiety are so simple you can't get people to do it. We kind of think that if we're going to correct something or fix something, it needs to be complicated. Oftentimes, it isn't so. For instance, because it's so physiologic, for people and kids who are highly anxious, exercise is crucial. Okay? Nutrition is crucial. We talk about getting rid of the cats: caffeine, alcohol, tobacco, and sugar. Okay? Usually I don't tell people go cold turkey, but you go down on the caffeine, you go down on the sugar, you go down on your drinking. Caffeine doesn't seem to be as much as a big issue. With kids, in most of the seminars and workshops I've been to in the last few years, on the nutrition front, they talk a lot about fish oil with omega-3s. And I'm just sharing that with that. I don't know the efficacy of that, but that comes up a lot. Sleep. Highly anxious people need more sleep than anybody. The American Academy of Pediatrics says that kids 14 and under, that 79 to 83% are not getting enough sleep at night. If treatment is needed with a professional, you think it's gone on too long or it's too severe, sort of in the field of therapy, the most empirically researched there's some other things out there, is cognitive behavioral therapy mixed in with some meditation mindfulness. If you want to take a look at meditation mindfulness, Sunday's New York Times has got a great article about how to meditate. But meditation, mindfulness, and then you go to a therapist, don't have to be certified in cognitive behavioral therapy, but need to know something about it, because you have to change the thought process and then you intervene behaviorally with that. If you want to get serious about dealing with it, you look at Vanderbilt's, it's not called the Center for Integrative Health, it's their holistic arm. It's called the Osher Center for Integrative Medicine. And you look up a mindfulness-based stress reduction, MBSR. And that's an 8-week course that they do at Vanderbilt to teach you how to use mindfulness and how to use other techniques to get the clutter, to get the obsessiveness out of your head and learn how to be more present in the moment. Meditation, I mentioned. That's really good. Mindfulness, you may be interested in one of these Wednesday night series to get somebody to come in and do a few weeks on mindful parenting. Centering prayer is a huge emphasis in the spiritual community. I would, rather than me spending any time in that, I would ask you to look at Farrell's sermon from mid-July. I think it was July 24th. And if she doesn't answer all your questions on prayer, then just come to church on Sunday, because Clay has said he will answer all the remaining questions we have on prayer in Sunday sermon. People who participate in a Bible study. There's good research. People who are serious about Bible study, their anxiety is significantly reduced. One of the things I use a lot with people is a worry list. Is what you do is you make a complete, comprehensive list of everything that's making you anxious, everything you're worried about, everything that concerns you. And you make it as comprehensive as you possibly can. And then you get up in the morning and you have a second sheet of paper. And you go down that entire list and you ask the question, what can I do about that today? It separates the things today that I have control over from things that I really don't. So it keeps the overwhelming down. You cannot ignore things like your concerns. Most of us are bright enough that if we're concerned, worried, and anxious about something, there's going to be a kernel of truth in it. It's not going to be stupid. But to get control over what is it I specifically have control over today from things I really don't. And then the gimmick with that, again, this is corny, is that you keep that worry list in a specific place. It's a way to compartmentalize. It gets it out of your head by writing it down, and then you're keeping your concerns somewhere. I had a client several years kept his worry list in the freezer because he wanted to chill. Which sounds kind of silly. Obviously it is, but it worked for him. So this is where I may get out of coming back, because this is where I get a little corny. Is because it is so physical, because it affects the senses more than any other emotion, one of the ways that we want to get anxiety issues is by use of our senses. Touch. People that do acupuncture or have massage skills and that kind of stuff. There's evidently an area between our thumb and our forefinger that massaging that is supposed to have a positive effect on reducing anxiety. This kind of stuff that I'm giving you right now is particularly good for kids. The last thing that's helpful for kids is to tell them to ignore something. You've got to give them something to do. We see it in just settle down, and we also see it in social teasing, which we call bullying's gotten way, way overused. I sort of have the mantra that teasing becomes bullying when the recipient's my kid. But we got to give kids things to do. So when they get anxious, one of the things on the touch thing is massaging this. Another thing we do is you take a golf ball or one of those rubber balls or paddle, and in the palm of the hand there's a stress point right in the palms of our hands. And you simply rub around on this. And whether it really reduces the anxiety or it's just a distraction, I don't know, but I don't care. It just works. Okay. Another thing, and they're doing this in some schools now. When I said 1 in 7 kids are qualified for the diagnosis, if you got a class of, say, 18, then you got 2 to 3 kids in that class that are going to be anxious. And that is going to make the entire class anxious. It is that contagious. You can't have that much anxiety in one room without it spinning somewhere out of control. So in some places, what they're doing for kids is when they have to take a test, they'll just have a bowl of ice water, where a kid puts his hand in ice water as he comes in the room. My son, who's a physician, said that in the ER, sometimes when people come in with a rapid heart rate, they'll have them put their face in ice water as a way to bring down the heart rate. And so ice is really effective. There's also just taking an ice pack and just putting it on your forehead. The simple one is you just rub your hands like this very quickly and put it on your face. The warmth of your hands will have some effect on reducing some of the anxiety. And again, the old common sense thing, just taking a warm bath. Smell. Hazelnut and lavender candles are supposedly the ones of choice. It's really interesting. The stuff I've been seeing, it's really hard to get a hazelnut candle, by the way. You can get them combined with all kinds of stuff. But hazelnut and lavender candles, they really do have a calming effect. The smell works with that. For kids who are highly anxious, caffeine is not good, but the aroma of coffee is. And so we'll have a kid take some coffee beans, put them in a baggie, punch holes in that baggie, and then keep it in their backpack. And if they find themselves getting anxious, they just reach down and touch the baggie and put the smell of those coffee beans up to their nose as well to have the calming effect through the aroma. My favorite of all is peppermint candy. This has become unknowingly, you can also use spearmint, and you can also use a ginger chew. And the deal is you put this in your mouth, but you're disallowed from chewing it. You put it in your mouth, but you can't chew it. You got to just let it dissolve. So you're hitting the taste, you're hitting the aroma, and you're hitting the breath because you have to slow down in order to keep from chewing on it. The reason that this offensively simple thing is this has become my own personalized stress test. We oftentimes don't know how much stress we're under. Others tend to know better than we do. We're just not that self-aware. But if I put this in my mouth, I can tell how stressed I am by how hard it is to keep myself from chewing it. If I want to just bear down on that sucker, then I know my stress is over the top. If I put it in there and I'm just easy kind of letting it dissolve, then I know I'm probably in a pretty moderate zone. On the food front, dark chocolate, oranges, sweet potatoes, apricots, nuts, turkey, avocado, and on the common sense side, a cup of hot tea, caffeine-free. On hearing stuff, okay, it is for kids particularly, but for us, is developing a playlist that we know when we are wound up can have a very calming effect. My wife made for me a playlist of my favorite hymns, and I keep that thing pretty nearby, and I like to listen to it anyway, but it's particularly useful in times where my stress is kind of going over the top. For kids who are highly anxious, a recording of familiar supportive voices, a kid who's freaked out by a test that's coming up, is making a recording of mom and dad having reassuring comments, or a couple of friends saying, you're going to be able to do this, this is going to be okay. It goes into the senses. Okay. On the seeing side, I mentioned absolute rule of thumb, no screen time for adults or kids at least 30 minutes before bedtime. It's not the content of what you're looking at, it's the light. The light tells the gland that releases melatonin not to release the melatonin. Now, I'm not saying content's all okay, but if you're with a device and you just put it down prior to going to sleep, that statistically you're not going to go into the deeper levels of sleep. I've already mentioned on the amount of screen time for lower school, middle school, and then the obvious stuff is bright lights tend to be more wind people up, calmer tones, et cetera, et cetera. And then here's my biggie to finish up with, and then we can talk if you got any questions, is the best antidote to anxiety is gratitude. You cannot be in a state of appreciation and be anxious at the same time. They are mutually exclusive. And there's a good bit of science behind this, is if you take somebody who's fairly anxious, seemingly for a long period of time, and you, with the fancy fMRIs that we have available, take a shot of their brain, and you look at the part of the brain that has to do with anxiety and depression, and then you look at the other parts of the brain that have to do with concentration, creativity, and memory, or cell phones. And you take an image of that person, and for 6 months, they go through the disciplined exercise of writing down at the end of each day 3 things they've been grateful for in that day. And you re-image that same brain 6 months later, and the part of the brain that has to do with anxiety and depression has diminished significantly, and the part of the brain that has to do with concentration, creativity, and memory has shot up significantly. So we ought to be good at that. But gratitude is by far our best of all these gimmicks, way to get at the anxiety we experience. And that's about all I got to present, but we can do questions.